Hello, it's Dr. Erica. Thank you for joining me on this particular video. I am going to talk about vaccination, particularly the varicella vaccine or zoster vaccine, which helps to fight off the reoccurrence of the varicella infection. The varicella infection is also known as chickenpox, usually during the pediatric or adolescent age range. So once that particular virus presents itself, it becomes dormant later on in life, but then it reoccurs or reemerges as the shingles or as the varicella rash. Okay, and it is preventable as the shingles by taking the vaccine, the zoster vaccine. This particular one is called Shingrix or Shingrix. There was a previous one on the market called Zostavax, which is also very much effective. But today I'm going to talk about the Shingrix. Shingrix is indicated for those who are 50 years old and older, and those patients are likely to experience the reoccurrence of that virus in order to prevent the rash, which is very painful usually, as most testimonies have come through, that is very painful, very much so, and any area of the body, whether it be the lower extremities, the torso, the back, also facial areas as well, the neck area. The Shingrix rash is very painful, I was told, and can be prevented. So we want to prevent that using the Shingrix vaccination. The Shingrix vaccination is a two-part series, okay, at 0 months and then at 2 to 6 months. I recommend patients take the vaccine as soon as possible at the 2 month period to complete the series and be fully vaccinated, okay? So I wouldn't wait, I wouldn't hold off on the 6 month time frame, although some people might need to wait that much longer. I would recommend the 2 months after the initial vaccination injection. It is a powder form and it comes with the actual diluting solution to mix. Pharmacists and doctors, nurses can do this procedure. I recommend pharmacy because once you get to know your pharmacist, they recognize you, you're in and you're out, you got your vaccination. They work with you on a personal level to make sure that your vaccinations are all covered and up to date and you don't have to wait around. You go in, you walk in, do your survey, and get your appointment then and there. Most insurances do cover for the Shingrix, most of them don't. It just depends on the type of insurance you may have. So do check with your insurance first before going into the pharmacy to make sure that you are being covered completely. As far as cost, your cost out of pocket can be around $200 to $250 usually, but I think it is very much appropriate to get the Shingrix to offset the rash that will likely occur in those patients who had a previous chickenpox previously in life. Now, the Shingrix, again, is a two-part series, and it is at 0 months and 2 to 6 months. And I suggest, again, 0 and 2 months, okay, just to be sure that is consistently there and effective. Okay, and it's indicated for patients who are 50 years of age and older. So if once you turn 50, you are eligible for this particular vaccine. Okay. Um, Also, Shingrix is stored in the refrigerator, whereas the Zostavax vaccine was stored in the freezer, which makes it more transferable uh, and so forth. So I recommend the Shingrix vaccination, and it is on the market still. So I have had the pleasure of actually mixing and administering this vaccine. So I do recommend it to all patients who are eligible, whether you've known that you've had the chickenpox or not, whether there's someone who can vouch that you've had it or not. Go ahead and get the vaccine anyway to make sure that you are covered. So if there's any questions or comments, please let me know. I'm Dr. Erica, pharmacist. For close to 10 years now, I'm the owner of Millennium Pharmacy. My website is www.millenniumpharmacy.com. Please visit, like, share, and subscribe. Share with your neighbors, family, and friends. And I hope to see you on the next video. Thank you. Bye-bye.